name is Crystal Gonzalez. I'm going to be your occupational therapy assistant for today. How are you doing?
Good. Mm-hmm.
That's good to hear. Before we start our session, I just want to confirm your full name and date of birth, please.
Francis Perez, 80297.
Okay. So I was reading in your charts that you were having trouble with your shoulder. Can you go ahead and elaborate on that for me, please?
Yeah, about a week ago I hurt my shoulder, and my doctor just recommended that I come to therapy.
Okay. That's good that he recommended you. What we're going to be using in today's session is an ultrasound. Have you heard of that before?
Yeah.
Yes? Okay, so it's going to be this machine right next to you. On a scale of 0 being no pain to 10 being the maximum pain, where would you say you're at right now?
Like around an 8.
An 8? Okay, so it's pretty severe right now.
Yeah, it hurts a lot.
Okay, well hopefully using the ultrasound it'll decrease your pain.
Okay.
Some of the benefits of actually using an ultrasound is that it increases your cell membrane, it regenerates your tissue, it increases blood flow, also it alleviates pain, and it increases nerve conduction.
Okay.
Before we actually start though, I need to make sure that you're a good candidate to go ahead and use this on to make sure it's safe to use it on you. Okay, I'm going to ask you a series of questions. Is that alright?
Yeah.
Okay, some of them might be a little weird, but trust me, I just need to know to make sure it's safe for you.
Alright.
Okay, so I'm going to start off with the weird question first.
Okay.
Have you had breast implants?
No.
Okay, are you pregnant?
I'm not pregnant.
Do you have a pacemaker?
No.
Have you had cancer before? Do you have areas of active bleeding anywhere on your body? Do you have impaired circulation?
No.
Any infections that I need to know about? Do you have, on your right shoulder, do you have any cuts, bruising, open wounds? No. Is it alright if I check?
Yeah.
Okay. Just gonna go ahead and tie this for you. Okay. Everything seems to look good. So you do seem like a good candidate. Is it something you'd want to do?
Yes.
Okay. Do I have your permission to go ahead and get started?
You do.
Okay. So first, I'm gonna actually clean up your shoulder. Do you feel this?
Yes.
Okay. Does it feel a bit cold?
No. It hurts a little bit. But
Okay.
that's just because, like, of my injury.
Yes. All right.
Are you going to spray that on me?
I'm actually gonna spray this on the head of this, and I'm going to be using this gel right here to put it on you. It's gonna feel a bit cold, but don't worry, it's only to help you. So I'm just going to put the settings. So right now what I'm doing is I'm just putting the settings to go ahead and use this on you, and we're gonna do it since it's your first time using the ultrasound. We're gonna go ahead and do it for 5 minutes, but for your following sessions we're gonna go ahead and increase it to 20 minutes. Just want to make sure that everything's all right using it for the first time. Okay. I'm just gonna open this up a bit. And I'm going to put some gel. I know it might feel a bit cold. We do have to, yeah, we do have to put a good amount just so the head's able to slide over your skin. But
It's kind of like what they do with babies, right? Like,
yes, but instead of the stomach, we're doing it in where you're having your problem area. So I'm gonna go ahead and place the head on you. And how does that feel?
good.
Cold? Cold.
It's a little cold.
So like I said before, we're going to do this for about 5 minutes. In the meantime, I want to tell you some of the pros. It decreases pain and stiffness. So hopefully by the end of these 5 minutes, you'll feel a bit of relief. It also decreases inflammation. I noticed you have some slight inflammation in this area.
Yeah.
And it actually helps with tissue repair.
Kind of feels like a massage.
Yes. So that is essentially what I'm doing here, just to help relieve your muscles and the pain that you might be having. What are some things that you've been having trouble doing?
Everything.
Everything.
Like when I drive, I try to only drive with one hand. It's really hard.
Did you drive yourself here today?
Yeah,
or?
I did actually. Yeah. Driving, riding, I'm a student.
Oh,
Like,
okay.
Everything.
I can imagine like carrying your backpack and you have like heavy
I
books or
always
anything.
put, like, I do that one strap thing when I'm carrying my backpack. Just like sitting down hurts. Just sitting straight, looking up, like, I feel like it's just like even my posture, I'm slouching more. Sleeping, I can't sleep on that side. I work, like I work at Starbucks.
Oh my
and, like,
goodness.
I don't know if you've ever seen like the baristas there. We pump like all the pumps.
Constantly?
Yeah, we're pumping different flavors and we get like the blender and we put it onto the blender and just like even doing that, like I can only use my left hand and we have to like, I mean when the line gets super long we have to like hurry up and do the drinks real quick. Even doing that, like I'm getting slower at it and I still have to go to work. I can't be calling in all the time. Like I've called in like 3 or 4 times since this happened and I don't want to lose my job.
Well, since you're attending these sessions, I believe the ultrasound is definitely going to be beneficial to you. That way it will help increase your range of motion and reduce pain. That way you can get back to doing all those things, because I could only imagine how everything you just mentioned to me, it's affecting you a lot on a daily basis. So if you continue coming to your therapy sessions and following along with this, will definitely help you get better. I just want to mention, I know I had mentioned some of the cons, the pros. I would just like to mention a few of the cons. If you have another therapist doing this on you, the head that you feel me rotating on the back of your shoulder, it can't be lifted within the allotted time, because if it's lifted, it could potentially burn you. So that's just one of the cons. We can't use this over your spinal cord or any metal platelets. That is also why I asked you the series of questions in the beginning, to make sure that this wouldn't affect you in any negative way.
Okay.
And also, I know it's weird, but we can't use this on your eyes. Not that I would request to do this on your eyes, but just so you're aware. It's good to know when
I'm pretty sure there's like one person that was like, oh, let me try it on my eyes, and they went blind or something. They're like, oh yeah.
Probably. So that's why I'm informing you on the pros and cons. That way when you come into your sessions, you're also aware what's going on. And you're able to, if the therapist is having an off day and you tell them, wait a minute, I can't do it because, or something. So you're knowledgeable on this as well. So we have about a minute left.
Okay.
How does it feel?
Good.
Do you feel your pain has been going down a bit, or is it around the same?
Maybe a little bit.
A little bit?
Yeah.
Okay.
Like it just, honestly, it just feels like a massage. I don't even really feel like anything.
Okay. Well, I'll ask you again once the 5 minutes are up.
Am I supposed to feel something?
You're supposed to feel, well, not supposed to, but you are able to feel less pain.
Like right away?
It depends. Right now you could start moving your shoulder. It's not going to be a big amount of decreased pain.
Like over time, like as I keep on coming.
Yes, just for right now, like I said, since we're only doing it for 5 minutes. Okay, your time's up. So I'm just going to cover you up right here. So now let me go ahead and clean it first. Let me wipe you down. Okay. Okay. How do you feel right now?
Good.
Good? Everything's fine?
Mhm.
Okay. Just gonna go ahead and clean the head, make sure it's good to go for the next therapist. Here's another towel. Okay. So how do you feel, Miss Bettis? Good?
Yeah.
On the same scale we used earlier, 0 being no pain and 10 being the highest pain, where would you say you're at right now?
Maybe like a 6.
A 6? Okay, so it went down a bit.
A little bit, yeah.
Okay, like I said, it was only 5 minutes. So since everything seemed to work out, for the following sessions, we'll be increasing it to 20 minutes, and hopefully you'll feel the pain decrease a good amount.
Okay.
Do you have any questions for me?
Not right now.
Okay, let's go ahead and continue with the rest of the session.
Okay.